Presentation by Dr. Pranita. Now she is not here, so
Good afternoon, everyone. Myself, Dr. Pranita Sahal, and at the outset, I would like to thank.
Now our next presenter is Dr. PRANAV RANJAN. He will be presenting on the current landscape of artificial intelligence for detecting glaucoma management and its progression. He is the Vice President of AIOC and the President of
Good afternoon, everyone. And this is an absolutely new topic for me. I have been preparing and understanding myself as to what artificial intelligence is going to do. And the topic that was allotted to me was glaucoma. Iska full screen kar dijiye na? Can you do the full screen? The role of artificial intelligence and glaucoma. And this is the global prevalence of open-angle glaucoma, which is close to 54 million. Worldwide, the open angle. $53 million to be precise, the open-angle glaucoma. And the overall glaucoma which has been detected is approximately to the range of 80 million. These are the tools which are basically required to make a diagnosis of glaucoma. And you see in the center is the fundus imaging device, the fundus camera, which has been of lot of interest in artificial intelligence. And this is the neural pathway that the optic nerve, the optic chiasma, and the entire eye basically covers the entire brain parenchyma. Overview, we have already seen the two important aspects in which the artificial intelligence is going to be applied is diabetic retinopathy, glaucoma, AMD, and ROP. These are the things. Prelude that glaucoma, early glaucoma is typically asymptomatic, and this is one place where artificial intelligence can tell you how to predict glaucoma at a very early stage. And with more patient and less chair time and the volume, we have to ensure that nothing is overlooked, and for that, this artificial intelligence, without taking much time, can give you as to what the patient is going on, how the patient is going to behave. What I just said, that approximately with about 90% of the rural population and 50% of the urban population remaining undiagnosed as far as glaucoma is concerned, here the role of artificial intelligence is going to come handy. What is the role of artificial intelligence? As in other diseases, screening, early detection, diagnosis, classification of glaucoma, quantifying risk factors, progression through automated processing of large pool of data. Why this is important in glaucoma and why this becomes relevant? Because there's a lot of data in glaucoma investigation, whether it is perimetry, whether it is OCT finding, whether it is the fundus camera finding. So a lot of data is there. So all the data if they are collected and each of them are interlinked with each other, the prediction and the diagnosis becomes easy, and that can be done by the deep learning of the machine. The basic definition has already been covered. The most important is the machine learning and the deep learning. The deep learning basically is the interpolation of all the data from various sources so that you come to a definite conclusion, come to a definite diagnosis. IOP is one thing which has not been very much understood by artificial intelligence, but still it holds true to the fact that something can be done for it. One study which used triggerfish, it is a contact lens based continuous IOP monitoring system, and with this continuous IOP monitoring system for 24 hours can give you a lot of data, and this data can be interpolated with the kind of fluctuation and the kind of progression that the glaucoma can become relevant, and artificial intelligence can play a good role here. This is one aspect which has been thoroughly and intensively and extensively studied is the optic disc photograph, and a lot of research and a lot of algorithms have come in from various sources which shows a high sensitivity and specificity almost to the range of 95% and 92%. A lot of work is being done here, and how it works, basic understanding, I also try to understand this. It is a pooling of all the fundus data, and this data by an expert is defined into two categories, categorized like whether it is glaucomatous and non-glaucomatous. And based on that, it is fed into the machine. Now the machine develops an algorithm, and these algorithms can have actually a better result than the human examiner. And the photograph in the bottom shows that you take a fundus photograph that is taken to the machine. The image is convolved, it is pooled, then it is processed, and finally you get an output, whether it is a definite glaucoma or a non-glaucomatous. And that is a set of deep learning by which it is arrived at. When we look at any fundus picture, a human looks at a fundus picture, he sees the picture in black and in colored this thing. But when a machine looks at a picture, it looks at into it with numbers, various numbers it gives. So every image that is captured is given a number, and that number is fed into the machine, that is stored in the machine, and whenever a new, and then that is branded whether it is glaucomatous or non-glaucomatous, what is the CD ratio, what is the NRR, etc., etc. The various parameters are all fed into it. And whenever a new photograph, fundus photograph, is fed into the machine, it compares with the previously loaded data and gives you a final outcome. These are the various imaging algorithms that have been carried out, like the Khalf Innovations from India released retinal image analysis glaucoma cloud-based software in 2016 to analyze fundus images. It uses an advanced image processing algorithm to measure the optic disc, cup size, CD ratio, NRR thickness, disc damage, likelihood score, and to look for violation of isn't rule. It also uses deep learning to learn from the user in case of errors in automated detection. Another field is the optical coherence tomography, the OCT. The OCT automatically measures the disc, the cupping, the NRR, the retinal nerve fiber thickness, the glaucoma, the GCL thickness. By Singh et al., the artificial intelligence image processing technique is known as segmentation. Muhammad et al. Have showed that a hybrid deep learning method on a single wide field swept source OCT has a 93.1% sensitivity in detecting glaucoma suspects. Ashoka et al. Evaluated a deep learning algorithm with a pre-training that diagnosed glaucoma based on macular OCT, and that was a replacement for RNFL and GCL. Artificial intelligence also can come handy for anterior segment OCT, and it can classify by segmentation of structures whether the angle is going to be of what kind, whether it is going to go into an angle closure or not. So this is also one thing which is going to be very, very helpful. Visual field is one thing which has really taken the artificial intelligence in a big way, and it can help in rapid and accurate interpretation of visual fields. Ashoka et al. Used a feed-forward neural network to identify pre-parametric visual fields which did not meet Anderson's criteria. Lee et al. Evaluated a convolution neural network to automatically differentiate between glaucoma and non-glaucoma visual field. Anderson et al., they have trained the artificial neural network to obtain 93% sensitivity and 91% specificity in evaluating glaucoma visual field, and it performed as well as the clinicians. Bod et al. Has successfully analyzed the FDT perimetry data. So this is the visual field that we see the printout. These fields do not quantify the nature of regional loss, and the summary indices in the form of mean deviation and the PSD, they are limited to overview only. So we need to get more information on the visual field, and this more information, this was studied in the archive type of analysis done by Tobias Elzy from Howard University, in which the regional defects were given, were segmented and given a linear equation, so that we can find out that from the top, this defect is basically 43.3% in this area of the normal. This defect here is 33.6% of the normal, and the other one is 22.6%. So all the areas in the visual field, they are given a different probability whether how much of normal they are. And based on that, 2 decades of study, almost 20 years, 2,045 retrospective fields were analyzed, and in which the 5 scientists, the doctors, they worked on and they found that there are 14 patterns of visual field that can be assessed and that can be detected. And based on that, this visual field was the one which was giving a lot of interest. This created a lot of interest, and this is the central area which is getting affected first. So what they said, and especially in the normotensive glaucoma, the interest was there that instead of a peripheral loss, there is one pattern in which the central loss is there. So this also has to be kept in mind that glaucoma is not only a disease which affects the periphery, it can start from the perimacular area also. The combined approach, it combined the non-ophthalmic factors and the ophthalmic factors. The non-ophthalmic factors that were combined were sex, age, menopause, duration of hypertension, and 5 ophthalmic factors: the intraocular pressure, the refractive error, vertical CD ratio, presence of superior temporal and inferior temporal RNN defect. These five parameters, and altogether the 9 parameters, they were interpolated with each other, and it was found that even without a visual field, they can predict glaucoma diagnosis. They can diagnose glaucoma and they can predict the progression as well. So predicting prognosis, the various machine learning detects the visual field progression consistently, even with slow progressors. It works on a portable perimetry device like the screener, etc. When Lee and colleagues trained a deep learning system with almost 32,000 visual fields taken between 98 and 18, and it was found that this can predict a visual field progression even before 5.5 years. Carlsman et al. Developed a validated Kalman filters which could predict progression of mean deviation of visual field at different targets of intraocular pressure. This would be helpful guide to customize and target the intraocular pressure. The future prospects, the algorithms are always getting better. The near future, we can expect to have an AI that has extremely good sensitivity and specificity, and it can surpass the human ophthalmologist. Combine various glaucoma evaluation can achieve a perfect diagnosis and prognosis. But the most convenient would be if a single test can be extrapolated using an artificial intelligence to predict the other. For example, if a single OCT can predict the visual field using an AI for extrapolation. The 6 pearls: try to make the best diagnosis, assess all major glaucoma risk factors, use all tools at your disposal. Do not underestimate life expectancy, do not assume that glaucoma damage will only be peripheral, and do not miss a good opportunity for screening. And for screening, not only do the human screening, but also take the help of artificial intelligence. So with this, I come to the end of the presentation. Thank you so much, and I thank Dr. J.G. Agarwal for giving me an opportunity to speak on the topic.
Thank you, Dr. Pranav. Just I want to ask you one question. How community will be benefited in the mass level screening to evaluate or
the data which I showed, that almost 90% of the population in the rural area, they are still undiagnosed. And 50%, almost 50% of the rural population are undiagnosed as far as glaucoma is concerned. So that 90%, if they can have the fundus picture, if they can send the fundus picture, that would be a great benefit. Because sitting here 200 or 300 miles away from the villages also, so we can get a close assessment of the fact whether it can be glaucoma or not, and based on that, those patients can be called. So that's a very convenient way of diagnosing things.
You have mentioned that software for 2016, but 2020 there's another software has come, most probably from Bangalore, Remedio.
While going through the literature, what I found basically that if one tool can interpolate the other tool, like OCT picture can take into account the fields also, predict the field also, that would be a great advantage, because multiple examinations, instead of doing a multiple examination to arrive at a diagnosis, it's always better at the level of screening that you do one screening test and you come to a almost conclusion that this is what.
No, during screening, first will be the fundus picture.
Fundus picture is the most important. Fundus picture is the most important.
To whether the patient further go for OCT
Absolutely.
Lastly,
Because one thing I learned from the literatures is that the fundus picture, there are two aspects to it, right? One is the machine learning. The machine, by taking a fundus picture, the machine learns only the outlines, basically. Only the outlines. It will give what is the diameter of the disc, what is the diameter of the cup. Whereas in deep learning, there are other factors also, like the contrast, the vessels, the slope, the elevation, everything is taken into account. So through deep learning, it becomes a complex process and we are able to understand the mechanism more precisely. And if those data for 10 years or 20 years, they get validated, then we are pretty close to coming to an accurate diagnosis.
Do you know any software which analyzed all three steps, that is?
I think you know better than me, because you have been doing this workshop for a pretty long time. Can you tell us, is there any software?
Actually, I don't know that it is at present in India, but outside there are lots of software is there.
So the software are going to come, they are going to develop, and they are going to become more robust. Robust in the sense, you can really depend on them. You can really depend on them.
Oh,
yeah, even if you are not a glaucoma specialist, even if you are not a ROP specialist or a diabetic specialist, at least you will be able to arrive at a diagnosis and send the patient with a proper referral.
Okay, thank you, Dr.